There are three body of work I want to address here at this 2017 ESMO that come from our working group in our institution. The first one is an alliance-led study of cabozantinib versus sunitinib. That was presented actually the last ESMO in 2016, but we have an updated result of the independent review of the scans in these patients that were randomized to receive cabozantinib or sunitinib. These patients with metastatic RCC of poor and intermediate risk. And actually on an independent review of the scan, independent review overall, the hazard ratio was even better, dropped from 0.66 to 0.48, suggesting both an independent and investigator review that the primary endpoint of progression-free survival was met. Response rate were lower on independent review, but still double that ones of sunitinib. This is a population hard to treat, was patient only, again, intermediate and poor. A lot of them have bone metastases and have poor performance status. The other thing I would like to add about CABOSUN is the fact that updated toxicity profile did not show any difference. So again, a trial, a randomized phase 2, smaller trial, showing cabozantinib superior to sunitinib, both on investigator and independent review for the primary endpoint of progression-free survival. I would also like to highlight two planned studies. They are opening up now and accruing actively patients. Two studies in unmet need. The first one in the adjuvant setting. There has been multiple trials on kidney cancer, the vast majority negative, in patients with high-risk renal cell carcinoma, those patients at higher risk to relapse after a curative intent surgery. In one of the studies that we planned and is open to accrual is a keynote study randomizing patient to placebo versus pembrolizumab, the PD-1 inhibitor pembrolizumab. The patient population will be high-risk patient and will have also a subset really very high risk with M1 NED, those patients with metastases, usually oligometastatic disease that were able to be resected are NED. No evidence of disease will also be randomized because the standard of care mostly as of today in these patients is surveillance with scans. So an important study with a lot of hopefully tissue blood collected for biomarker question. Study open and enrolling international study. So stay tuned. Hopefully one of the big meeting at ESMO, it will be there when we hit the events. Another study is in really unmet need also, which is the rare type of kidney tumor. We group them under non-clear cell RCC, and a specific population is the one with papillary kidney cancer. That is rare, although is the second most common after clear cell RCC. And now we know for some time that a subset of these patients do have alteration in a specific gene called MET. They have chromosome 7, trisomy, MET gene mutation, somatic mutation, amplification, or sometimes the ligand is amplified. Anywhere between 30 to 50% of all papillary RCC. We have conducted a phase 1, then a phase 2 study that showed the highly specific MET inhibitor, oral MET inhibitor, savolitinib, has activity in that population, but exclusively in this population that have MET alteration. So based on that, these patients do not have really a standard of care. We use sunitinib based on testing this drug like we did with clear cell RCC. So we are just launching a study, a randomized phase 3, where we test, it's a biomarker-based study, one of the first in this disease, that test the patient tissue, a patient with papillary RCC, to see if they have a MET alteration. If they don't, they get another therapy. But if they do, they get randomized to the pure MET inhibitor, savolitinib, have an excellent track record in terms of safety from the phase 2 trial versus standard, at least the closest to a standard, sunitinib, with the primary endpoint being progression-free survival, hopefully providing an option for the patient with MET-driven papillary RCC. So exciting times. for renal cell carcinoma. We had a great ESMO 2017. There was a plenary presentation by Dr. Escudier, and there's a lot of planned studies that hopefully will change the standard of care and push the envelope in renal cell carcinoma towards more cure and better survival.